Okay, this video we are going to be looking at a few of the muscles of the trunk and dorsal region. All right, when we're looking at this, we are just looking at a few of the muscles, and we're going to look at them in a generic category. We're not going to break them down into smaller components, although I will point out some of those differences. Let's look at the anterior abdominal region first. So let's go to, what video is this? 1626. Under the abdomen, let's just click on that. And what we're looking at this, there's actually only two muscles that we're going to look at this. I will point out the other ones. Extra credit, always possible. The reason we're breaking these down a little bit more is depending on how visible they are on the models. Hard to get tested on something if you can't see it on a model. Okay, so the first one we're looking at, let's look at the rectus abdominis. This is your standard six-pack muscles. Okay, we all have them. We all have the six-pack muscle. I myself favor the pony keg. Okay, so that's what we're looking at here. It doesn't really show the six-pack on here, but if I fade that out, you can kind of see the muscle bellies, and we're just having an aponeurosis in between. But these are the muscle bellies, and it's going to be bilateral. So this is part of the external oblique. So let me hide that one so we can see it here as well. So this is going to be your rectus abdominis on both of them. Let me hide that aponeurosis. There we go. Okay. And so this is the rectus abdominis. This is tendinous aponeurosis. This connective tissue in the center is actually the linea alba, okay, that kind of connect the two, that what we're looking at. So when this muscle contracts, you can see the fibers go superior, inferior in orientation. So if they contract, it's going to be pulling forward. So one of the things, and now look three-dimensionally on your body, okay? So if your abdominal muscles contract, or your rectus abdominal contracts, yes, it's contracting and it's compressing your abdominal cavity, okay? But it's flexing your vertebral column, because we're going forward, it's flexing your spine. Okay, your vertebral column. So the action of the rectus abdominis when working together bilaterally, it flexes your vertebral column, tenses the abdominal wall, compresses your abdominal structures. This is one of those muscles that you are going to use, which is a orthopedic, or not an orthopedic test, a test called Valsalva maneuver. You use it going to the bathroom, okay? And basically, if you were just to don't do this, but act like you're going to the bathroom where you're compressing your abdominal musculature. Hold your breath, bear down. That's what's doing this as well. Okay? So that's going to be this one. Let's see. The other one is your external oblique, which is this one. Now look at, you can see where the rectus abdominis muscle kind of disappeared. It's because it's deep to the external oblique. So external oblique is here. So let me hide half of this, and voila, there is your rectus abdominis. We're going to have other oblique. This is going to be an internal oblique, and then we're going to have a transverse oblique here. And it's basically going to be the orientation of the muscle fibers. So this is your external oblique. And if you compress, or if you contract bilateral, so you're contracting right and left side, you are flexing your vertebral column and you are compressing your abdominal cavity. Unilateral is going to be laterally flexing the trunk and rotating of your vertebral column. So you're rotating as well. Okay, so that one's this one. There's going to be, actually there's the key four muscles that we're looking at for the abdominal cavity: rectus abdominis, external oblique, internal oblique, which is deep to the rectus abdominis. So let me see if I can hide that one. That's going to be the transverse. Okay. So this is internal. You can see the orientation of those fibers. So let's look at this one. You can see the fibers kind of go superior, inferiorly, from upper outer down, interior oblique. Fibers are going from bottom to the medial versus this direction. And transverse, you've got transverse fibers. You can see that, okay? For our purposes, I think for identifying purposes, our models really don't get into the transverse abdominis that well or internal obliques. We're going to be focusing on that, although there might be additional extra credit questions, whether it's in lab or lecture, okay? So that's going to be the anterior part that we're going to look at. So now posteriorly, we're going to do a basic, what's this, 1616, scroll all the way up. Okay, we're going to be doing to the vertebral column erector spinae. So this tells you automatically erector. It's bringing you back up, so that's going to be extension of your vertebral column. And this is actually, just saying erector spinae is the basic category that consists of 3 different muscles, depending on the region, okay? Actions are all going to do with extension. If they're bilateral contraction, it's going to be dealing with extension. The other ones will deal with extension, maybe a little bit of lateral flexion, a little bit more rotation and flexion, maybe head lateral deviation, okay? And I'll point those out. But for our purposes, let's look at this one. And we're seeing all 3 of the different erector spinae. So all of these, we've got spinalis, longissimus, iliocostalis, okay? Our objectives just say erector spinae. So basically, if you're looking at these muscles, those are the erector spinae muscles. And depending on if they're more medial, moving out lateral, then we can identify those differently. So here, this is going to be the spinalis, closest to the spine. I guess that's a good way of looking at it. You can see it goes up into the neck, as well as the thoracic region on this one. Longissimus, if we were to move out more laterally, if it's now this will do vertebral column extension as well for bilateral contraction. All of them will do that. Unilateral is going to be dealing with more of a rotation and lateral flexion, so it's going all the way up to the skull. So this one is also going to be dealing with the head motion on this one. Iliocostalis is going to be unilateral contraction, will be more rotation and lateral flexion on that one. So if we're looking at, and the next 3 essentially just point out what I just showed you here, but they break it down into different ones. So here's the longissimus, just that one, okay? And you can see on here we have capitis, so we've got the part way up at the neck, cervicus, and thoracics. We're not going to that much detail in our class. I just wanted to point these out to you, especially if you're going into the PTA or PT programs. You'll understand that you can go into far more detail on this. If you were to go the iliocostalis, or here's the spinalis, this is the most medial one, okay? So we have cervicus and thoracics, okay? And then the very last one, iliocostalis. Did we just do this? No, we didn't do this one. Cervicus, thoracics, and lumborum. Okay, so those are the different ones on that. We're not going into that specifics. Know them as your generic group of erector spinale or spinae muscles. Extra credit might be how many muscle groups are there within this category? And the answer would be 3, something like that. Okay. That's it for this video. Next video we're going to do, looks like the pelvic girdle.